I didn't choose sexual health as a career, it chose me. I did science first, did a degree in microbiology, and then I did medicine. And then I was going to be a pathologist, and by sheer coincidence I happened to help out in an STD clinic in Dublin. And I remember that first night I worked in STD and I thought, wow, this is the job for me. Here you had fit, healthy young people with a serious infection that you could diagnose with 100% certainty, and pretty sure you could treat with 100% certainty as well. So just imagine the job satisfaction you get from that, knowing that you're actually doing an enormous amount of good clinical work in one evening. Wow, it just felt great.
So after my foundation training, I chose to do medicine, core medical training, just to gain some further experience in this area. And I found certain aspects such as HIV medicine particularly interesting. So I chose to do some taster days in this and some further projects which really sparked my interest in sexual health and HIV. And following on from that, I applied for specialty training and I've never looked back since. It's a specialty that kind of fulfills all my interests in medicine, and it's an area that's continuing to advance, and it's really interesting.
So I got into sexual health when I was doing some training for my membership exams as a senior house officer. I thought I didn't really know much about HIV, which was obviously quite a big thing at the time. So I went to sit in on clinic, and it was really interesting to see a side of medicine that I'd not experienced. So I have to say one thing: if you've never had a placement or anything like that in a sexual health clinic, definitely go and to take that time, because what I saw and what I experienced I really clicked with me. I think it was something I really enjoyed. I enjoyed it a lot, but I was then asked to actually do some locum clinics because they were short-staffed that week, and I thought, well, I didn't really know what I was doing, so you know, how could I work in sexual health so soon? But I sat in clinic, I was shown what to do. The consultant at the time sort of watched me do a few and then let me loose on a few patients, and I just really enjoyed it, and I kind of felt that this was where I was meant to be. So that experience was really positive. You get to sort of see a lot of stuff that you perhaps wouldn't see elsewhere, and it felt that it was something that I could really contribute to as well.
I originally started working in general practice and enjoyed obstetrics and gynecology, and realised that I preferred a more narrow focus in work, and sexual health seemed to give me that combination of a specialty where you could do bits of everything but still have a narrow medical focus, so you didn't have to know everything about everything like you do in general practice. You could concentrate on one area and really know it well. I like the idea that it's very public facing, so patients come to you straight from the street, so it's unpredictable and varied, and the topic is very interesting. It's an interesting part of life, sexual health and reproductive health. It's very important nationally, internationally, and you feel like you are really making a difference to people, but not in a way that perhaps more traditional medics might find when they're curing illnesses and giving out treatments. So you're doing it in a different way, but it still feels like you're making a lot of difference.
My job entails seeing people who are often upset and distressed. Nobody wants to come to an STD clinic, but when they turn up, they're really afraid that they will be treated with some embarrassment, but we can easily talk to patients and put them at their ease and make sure they feel comfortable in telling us some stuff that they've never told anybody else. So to work in our specialty, you need to be somebody who likes people, loves listening to stories, and can be empathic and compassionate.
So on a daily basis, we have walk-in clinics which are unselected, so patients may come in with either contraceptive needs or sexual health problems or something related to HIV. So we don't really have booked clinics, so we don't really have a say in what patient we may see. They may come in with one particular problem, but it may lead to lots of other things or areas that need addressing. For example, a patient may come in initially wanting a sexual health screen, but actually they need emergency contraception. Going forward from that, ongoing contraception and other healthcare needs might be addressed during that consultation. So it's really varied, the kind of patient that we see.
As a consultant in sexual health, we have a number of things that we do. sexual health encompasses all aspects really, so we've got STI testing and treatment, so a lot of my day job is spent seeing patients, testing and treating sexual transmitted infections. Contraception obviously is important for our female patients, but then there's the wider remit, so some health promotion. I'm really passionate about normalising sexual health, encouraging people to get tested, so reaching out to people, trying to come up with sort of ways of targeting people so that they can feel better about coming to a sexual health clinic and less embarrassed, so trying to reduce that stigma. So I think there's a sort of wider public health remit to what we do as well. It's really important.
My day-to-day job involves a combination of clinical work where I see patients in booked clinics doing procedures, intrauterine procedures, complex contraception and complex problems with patients with reproductive issues, and I also specialise in psychosexual medicine, so I see patients with sexual dysfunction. But I also do clinics where patients just walk in off the street on that morning with anything to do with sexual health issues, so that's very unpredictable, and that can be people who worried they've got an infection, it can be somebody who needs emergency contraception, a young person with lots of sexual health problems. So that's very unpredictable and enjoyable and varied. But I also play quite a large part within the department in training other staff. So I train nurses, I train doctors, I train GPs and gynecologists. I also train clinicians in psychosexual medicine as well, so I run seminars and we present cases of patients with psychosexual problems and try and understand what's happening in those areas. Another part of the job that's perhaps difficult to understand unless you experience it is the management side. So in sexual health, because it's in the community, you tend not to be bogged down with lots of processes and procedures that happen within hospitals, but you have to have your own, and they have to be quite tight as regards safety and governance, but they also have to be flexible enough to allow some interpretation in the community. And my job as one of the leading consultants in the team is to make that all work within a team. So there's lots of teamwork in sexual health, and it's not just within a clinical team, it's within other workers that work in the community, so they can be youth workers, pharmacists, outreach workers, HIV workers.
The bit I like about my job is actually talking to people and putting them at their ease and giving them compassion and understanding. It's very easy to make the diagnosis and treat it, so medically speaking there's no great issue, but it's the psychological issues that really are the key to successful treatment. I mean, patients should leave our clinic feeling okay. They shouldn't feel dirty or ashamed or embarrassed about what they've been through. Sex happens, life happens, and we're there to help them. Our job is to make them feel okay about themselves as well as managing the treatment.
I really like that a patient may come in with a problem, and just because of the nature of having things like the microscope and the kind of team aspect of the role that we have, that you're able to solve the problem that they come in with the majority of the time. So it's very rewarding. They may come in with a problem and you're able to address that in a kind of holistic way and form that relationship. And if you're I think the specialty demands that you're open, non-judgmental, and that leads to them being able to access services going forward and not really have a barrier or this kind of perception that they're not able to access our services.
The thing I like most is obviously talking to patients. I know it sounds really cliched, but we really can make a big difference to people. Being diagnosed with a sexually transmitted infection unfortunately still carries a lot of stigma. There's a lot of perceptions about STIs and how people get them or who gets them. And so when you are giving that diagnosis of maybe something like herpes, which is an infection that can stay with people for life, if you do it right, you can make a profound impact on their future sexual health well-being. If you do it wrong, it can lead to long-term psychosexual problems. But reducing stigma, promoting and normalising sexual health is really important. So talking to people in the right way, and how you say things sometimes is really important. It's so important that we don't come across inadvertently judgmental when we're asking questions. Wording a question in the wrong way can sometimes make a patient feel really uncomfortable. So I feel really privileged that people share some of their most intimate moments with us, but how we react and how we interact with them is really important to make sure that we get it right. And I really enjoy the fact that I genuinely feel we can make a difference to people in that most embarrassing and personal time in their life.
The thing I like most about my job is that patients really trust you to give you the really private, intimate information, and for you to help them then help themselves with whatever they need, whether it's to work out a contraception that's going to suit them, or whether it's going to work out what screening they need to test whether they've got infections, or whether they need to look at the sexual problem that they're really struggling with. And that's a real privilege, because you feel that you're really in a position of trust, and if you can work that through the patient and help them, it's immensely satisfying in a different way to the job satisfaction of cutting something out or giving the right medication. It's a different way of helping someone, but the result is the same, that you will feel really satisfied with at the end of the day. Hopefully, not always, but hopefully at the end of the day you will feel satisfied with the interaction that you've had with someone, and where you think you've given them information in a way that really enables them to make choices. So I think it combines art and science of medicine really well.
Obviously, when we come into medicine, some of us have got preconceived ideas of where we want to end up, and some of us don't. During medical school, we get exposed to all sorts of different fields of medicine, some of which spark our interest, some of which put us off, definitely. Sexual health, when I was at medical school, was not somewhere I really had a great deal of experience, and so something I hadn't really thought about until I qualified and actually spent some time in a sexual health clinic. So my advice would be, get some time. If you think it's something you might like, then certainly think about it. Get some experience, have a taste today, see what it's like, see if it fits with you. Do you fit with it? You know, it's something that you can really get a sense of even in quite a short space of time, so it's something worth doing. It's a career that gives you a lot of opportunities. It's got a relatively good work-life balance, which is important for most of us in surviving in medicine. But you do get to see a lot of really interesting stuff. You hear a lot of interesting stories. Certainly never a dull day in the sexual health clinic. So yeah, I'd strongly recommend people, if they haven't had experience, to get some experience and consider it.
I think a career in sexual health is really satisfying. It's medical, so it's not, on the surface it might appear that it's not as medical as other specialties, but it is. You have to know all your stuff, you have to know all your science, and you have to know all your treatments and what effects they have on people. But you also be able to have to work with people really well, the public. And you have to judge what's going on when you see them, and judge what they really need, and apply those skills that you acquire into helping people. It's got fun days, so nothing's the same every day. You have different people, different scenarios. You might not necessarily get to know patients in the way that maybe a GP might, so you might not get heavily involved in someone's lives, because it should be more short term, the work that you do. But it doesn't mean in those instances where you see people and treat people that you still won't be able to build up good relationships, because you can. So I would really feel that if you want a career that combines technical abilities, because we do procedures as well, with scientific application of medicine, and also with patient interaction of a very intimate nature, then this is a job for you.
I'd like to say to students who are watching these clips that sexual health is a wonderful career. If you like people, like talking to people, and can cope with distress and can be empathic, you will really enjoy a career in sexual health. The medical side of it is easy. Okay, we see some complicated conditions, but we have microscopy, we have excellent tests, so we can pretty much always be certain about the diagnosis, and the treatments are so good nowadays that you pretty much cure everybody. So basically, medically speaking, there's enormous job satisfaction in working in this area. It's a great career.
So I think it's really important to consider all your options when it comes to medicine and choosing a career that you feel is fulfilling. I feel that for me this was the right choice. I've never looked back since. Within a month of doing sexual health, I loved it. I fell in love with the specialty, and I can't really see myself doing anything else. Day to day I'm rewarded by either patient interaction or knowing that I've made a difference in someone's journey. I think consider sexual health, come and do a taster day with us, come and do maybe a week with us or a project, come and have a chat with us. We're a very friendly bunch. It's definitely a career to consider, I would say.